We have a room full of folks today. So as with tradition, we are going to offer folks an opportunity to provide comment on anything that's not on the agenda. Any public comment on items not on the agenda? I will just say that I thought that was a great Public Works, City of Missoula Public Works Committee meeting yesterday where we were talking about the proposal to rename the Higgins Avenue Bridge the Bears Track Bridge. And I will draft a letter on behalf of the commission, and maybe we can get it on the agenda sometime next week in admin. A letter that would be sent to the Montana Transportation Commission making the formal request. So stay tuned for that. I'll coordinate with you, Annie and Chris, to see what day would work to get that on the agenda.
So Dave, I just want to make a little comment if I can on that. I want to say thanks to you for your leadership on this, that you kind of pushed this forward and have made it happen. So thank you for that. And also want to say kind of what I said yesterday, how important this is, not just in the naming of a public artifact like a bridge, but this is adding to the story we tell all ourselves about our history and increasing accuracy, that this is a piece of the public. And when people interact with this, they begin to internalize our actual history, not just the one we've told ourselves thus far about the great deeds of the Misters Higgins and Warden, but the people who lived here long before any European settlers, and how we ended up with the kind of social configuration we have right now. So it's super important, great first steps in the reckoning that really needs to take place. So thanks for making this happen, Dave.
Absolutely. Well said, Josh. And yes, Dave, thank you for, tip of the spear yet again.
There you go.
As with so many things, definitely a team effort. So thank all of you too, and especially the tribes for their friendship with us and the collaboration that we have with the Confederated Salish and Kootenai tribes is certainly remarkable and I think a model for how other local governments can and probably ought to partner with tribal nations in the state of Montana. Any other public comment on items not on today's agenda? Okay, seeing none, let's dive right in. Our first item, Diana, do you want to share this with us? It's a proposed contract with Mckinstry.
Yes, thank you, commissioners. My name is Diana Mineta, Sustainability Program Manager for the county. So the context for this contract is the goal of carbon neutrality in county government operations that the county adopted in 2019. It's a goal of carbon neutrality by 2035. The largest contributor to the county government's greenhouse gas emissions is our buildings and facilities. And so to achieve that goal is most certainly going to require using energy more efficiently in those buildings and facilities. We a year or so ago identified energy performance contracting as a promising tool in the toolbox to help us move in that direction. There is state statute that authorizes performance contracts as well as rules through DEQ on the topic, and basically it allows public entities, including local governments, to enter into a contract with an energy services company that will make energy efficiency improvements in the facilities, and then for the public entity to pay back the cost of those improvements over time through the utility bill savings, with those savings actually being guaranteed by the energy services company such that the public entity is reimbursed if they're not achieved at the guaranteed level. So the county did a competitive solicitation last year for an energy services company and selected Mckinstry through that process. The first step in the energy performance contracting process is what's called an investment grade audit, meaning an in-depth energy audit of the buildings to identify the measures to be potentially included in a performance contract, as well as the associated savings that would go along with those and the costs. So the contract before you is for an investment grade audit the county decided to start with our two largest buildings. With the contract could in the future be extended to include other facilities as well, but at this point it includes the detention facility and the courthouse. After completing the investment grade audit, Mckinstry will provide the county with a proposal for an energy performance contract, and the county would have the option at that point either to proceed with the performance contract or to just stop at the investment grade audit stage. And I guess the last thing I want to say about it is that the cost of the investment grade audit, as included in this contract, is $74,648. If the county decides to proceed with a performance contract, typically that cost would be rolled into the contract and financed, and so it wouldn't be a lump sum payment. But if the county decides not to proceed, we would be on the hook to pay Mckinstry that amount. And I do want to mention that I've been working closely on this project with Jason Emery, Jason Hauser, and Andrew Charney, and I think at least a couple of them are on the line, and so may also want to speak up or answer questions. But at that point, happy to take any questions if the commissioners have them.
So this is Diana. I have more of a comment than a question, but I just think this is such a great thing from energy efficiency standpoint, but also from a fiscal responsibility standpoint, that the cost of the improvements we're making are made up through savings and they're guaranteed. So I'm saying this for everyone on the call, but especially our friends in the media, that the cost of doing this work is made up through the savings that they generate, and it's guaranteed. It's such a good deal for us. And thanks so much for putting this together. These are really complicated packages, and the work itself is super complex and really moves us forward in terms of meeting our goals. Thanks a lot.
Thanks, Josh. Andrew or Jason, or anyone else who's been a part of working on this like to chime in?
Yeah, I just wanted to clarify that the energy grade audit, Diana mentioned, after that's completed, we will have all the information that they have found that where savings can be had. And at that time, we can do a financial analysis and see if it's cheaper for us to borrow on a tax exempt basis and roll that energy grade audit into our own financing, or we have the alternative of letting them finance it and go ahead and pay for it from savings guaranteed. So we have two options at that point. Just want to make that clear. But you're right, it's a great deal.
Thanks, Andrew.
Yeah, I agree. I can't add a lot. Diana's done a ton of work on this, and I think it's a very viable mechanism to push this forward for us, without breaking the bank. And I think what I like about it from my kind of engineering technical background is we get to look at these as a whole system, in each of these buildings instead of piecemealing things. And because I think a lot of these efforts are codependent, and if you can look at them in their entirety, you can be a lot more efficient and more thoughtful about how you implement them. And Mckinstry certainly brings that capability to us, and things that we may not even think about, like small things like heat recovery and wastewater and things like that are kind of complicated, but they have the expertise to look at.
Yeah, I think it's worth highlighting that government oftentimes gets criticized for doing a lot of planning, but not as much implementation as folks would like. Well, this is a step towards actually implementing some tangible work on the ground that will further our energy conservation and sustainability goals. So I am thrilled to see this before us today.
And exactly how Emery was saying, the systemic nature of this is awesome. I'm so glad we can do this. I'm going to move to approve the contract with Mckinstry Ascension.
Thanks. I'll second that.
Any further discussion? All in favor?
I do want to know what the definition of ascension is with that spelling.
That is not a question I can answer today, but I'm happy to follow up with you. I can ask them.
Are you revoking your motion?
No.
Okay. All right. See no further discussion. All in favor? Aye.
Aye.
Thanks. And it
Thank
looks like
you.
Peter Christian just joined us. Hopefully he wasn't wanting to comment or ask a question on that one, because the train's left the station there. Sorry, Peter. although some people I suspect might be here for this next item, which the brevity of the description does not reflect the gravity of what it is that we're talking about. So, Chris, talk about
Yes.
the deed that's before us today.
So thanks, Commissioner. So this is the last step here in the Trinity redevelopment project that we've been working on. So this is the affordable housing and permanent supportive housing project that we have partnered with the city, Blue Line Development, and a host of others, including Homeward and others here in Missoula. And this is that last step. As you'll recall, last year you signed a resolution of intent for this project. And then in the later part of last year, you modified that resolution slightly based on final schematic design that moved the building to the south half of the property. And so this is the final piece as it's gone through subdevelopment review. Sorry, one last step. You agreed to the subdevelopment about 2 months ago. Sorry. And now we're at the piece here where we're finally ready to actually deed the land. And this deed was prepared by John Hart. It does have the required revocation. So if this land were ever not used for its intended purpose, the land would revert to the county. It doesn't become something that gets sold off or lost, in essence, as county land. This really is kind of like a long-term lease, although we don't really have those in the county. And so this restricted deed is the mechanism that we're using in this case. And so what we're doing today is authorizing the chair to sign the deed today and have it notarized, and then that will be submitted. That completes the last part of the subdivision process, as well as secures the financing for the Trinity project. And so that project will hopefully break ground in the not too distant future.
So good.
So needed. And when you say not too distant future, what are you talking about?
Their goal is to break ground this late spring or early summer. So I mean they are on the fast track. I mean it's still a 2-year development timeline, but they're moving, kind of using Dave's analogy here, full steam ahead.
Great.
Stealing from Dave.
Great.
Well, before we make a motion, we've got a whole lot of folks on the line here today. Is there anyone out there who wants to offer comment on this item? Okay, I would entertain a motion.
Yeah, I can't help myself. I got a comment, Dave.
Okay.
It's too good.
Yeah.
I just wanted to make sure other people could talk because I have a tendency to talk a little too much. But I just want to point out that this fantastic project is the result of a partnership between the city and the county and Homeward, Blue Line Development, and only because all these entities put their shoulder behind the wheel, the collective wheel, and added resources to it, that it can actually happen. And the other piece I want to mention about this is built into this housing is this permanent supportive housing with wraparound services and a navigation center. And as we have learned out at the temporary safe outdoor space, that these types of wraparound services really work, that when we interact with people who are at the bottom and give them services, provide services, they actually move forward. It really does work. We can get people out of homelessness and out of addiction and out of all kinds of other terrible spots if the resources needed are right there. And that's what this navigation center will do, and that's what the permanent supportive housing will do. And this really goes a long ways towards addressing a super intense, chronic, and intractable problem of homelessness. So, thanks.
Yeah, we see this. I certainly see this as a transformative project for the Missoula community, and it comes after long hours of discussion with the city, other partners, our law enforcement folks with the Missoula County Sheriff's Office.
Yeah, thank God. I'm sorry, I forgot them on that list. That's really important.
Yeah, because some of the questions that have come up over time is, this is currently county property. Have we taken into account the future needs of our detention facility and law enforcement? And indeed we have. We've gotten to the point where we are today in close consultation with the Missoula County Sheriff and his staff, and I think we all feel good about we've attended to our future needs here in Missoula County, and are also taking this bold move of partnering and conveying this land for a truly creative and I think transformational project for the community.
Yeah, this is happening at the blessing of the sheriff, not begrudgingly. Yeah, and he really made the link between the need for do we need more jail space, or do we need more people not to be going to jail because they are committing crimes related to the desperation of being homeless?
Right.
All right, let's. I'll move that we approve the chair to sign the deed for the Trinity project.
Second. It's been a long 2 years.
It has been. Any further discussion? All in favor?
Aye. Glad we're
And-
finally here.
And here is the deed on my desk.
Oh, great.
I will
I was
sign.
just going to say, Commissioner Strohmeyer, you should have the deed on your desk if you will take a moment to date and sign that, and then we will have it notarized and completed today. Thank you so much, Commissioner.
Dave, hold it up again.
Oh, hold up the deed.
Yep, hold it up again. This is fantastic. Thank you.
Okay.
There we go.
Okay, and soon the deed will be done.
Nice work. Nice work.
Yes.
All right. I know we have some members of the media on the line. Anyone have questions for this particular item? Okay, I guess you've gotten what you need. Moving on, Sam Scott, what do you have for us today? Or do we have anyone from, who is going to speak to the Montana Land Information Act grant application?
I am, yeah. Morning.
There's Sam. Okay,
Hey, Sam.
we got you now.
Okay, sorry about that. Yeah, so I'm here to request that the board authorize the chair to sign the Montana Land Information Act grant application that was put together by our office, the clerk and recorder, and the GIS division. We received this grant last year in the amount of just under $12,000 to continue or to begin our Map Missoula efforts, which we've talked about before, and we'd love to demo for you sometime when we don't have such a long agenda. But over the last year with those funds, we've mapped about 30,000 recorded deeds to parcels, and ultimately working to get to the point where we have essentially a point-and-click title exam. And so that 30,000 documents that we've mapped equates to about 5% of documents that have been recorded in the clerk and recorder's office since 1860. In the next year, we're hoping to get through another 25% of those million or so documents. And so to do that, we're requesting $37,646 from the Montana Land Information Act grant funds. And of this, what we expect to be about a 5-year project. This is year 2, and we're really getting into the bulk of these documents. And so that's why our grant request is increasing quite a bit. This grant request does not include any cash match, but it does include just over $29,000 of an in-kind match, which is going to equate to my time spent on this project supervising the staff that we intend to hire with the funds that we hopefully will receive. The funds will go towards hiring 1 temporary full-time staff for 10 months and then 2 interns from the University of Montana, hopefully continuing the relationship that we've built over the last year with them, 1 over the fall semester and 1 over the spring semester. And those staff will just continue to work on the linkages and mapping of documents that we've started over the last year. So with that, yeah, we would request that you approve the chair to authorize the application.
Thank you. Questions?
I'm really looking forward to the time when we can get another demonstration.
Yeah.
This is a fantastic project. I'm gonna move to that the chair sign the Montana Land Information Act grant application.
I will second that.
Any further discussion? All in favor? Aye.
Aye.
Thanks, Sam.
Thank you.
Okay, Melissa Gordon, we have a contract with Eco Northwest.
I do. So I am requesting that the board approve a contract with Eco Northwest in the amount of $30,000 to develop an affordable housing strategy for the county. And just a little background, in November, we issued an RFP for the development of an affordable housing strategy, and we selected Eco Northwest to do that work. They have been around since 1974. They're based in Portland, Oregon. They've been doing housing studies since 2000, and they've done 30 such similar studies in both rural and urban communities across the Pacific Northwest. So we're really excited about their experience and really excited to be moving forward and working with them. The project will start, or our work with them will start on March 1st, and the bulk of the work will be completed by August 31st of this year. So we're scheduled to have a kickoff meeting with the consulting team and the commission on March 8th. And shortly after that, they'll begin their public outreach efforts. So they will be reaching out to key stakeholders in both the city and in the outlying areas. The intent is for whatever plan is developed to complement city efforts and really to define our efforts in the outlying areas in terms of affordable housing. And then the end result is going to be a concise report that provides findings, recommendations, and outlines specific action steps that need to be taken. And I'm going to veer off course a little bit and introduce the person who will be implementing those action steps. We have Jordan Lyons on the line. This is day 3 for Jordan in his role as housing specialist for the county. So he'll be working really closely with the consulting team over the next 5 or 6 months, and then he'll be working to implement the action steps. And I'll just give Jordan a minute to introduce himself to you all.
Great, thanks, Melissa.
Yeah, thank you all for having me, and I've had the pleasure to meet some of you and seeing some new faces also. So I'm just very excited to be here. And I'll just tell you a little bit my background. I have my master's in public administration from the University of Montana, and I have lived in Missoula since 2007 and just worked for a variety of different housing agencies and nonprofits in town. I previously worked for Missoula AIDS Council, where I coordinated their housing program, and then Missoula Housing Authority. I was a property manager in affordable housing properties. I worked at Missoula Aging Services, and for the last few years, I have been the director of the ASUM Renter Center at the University of Montana. So I'm just very glad to be here. Thank you so much for having me. I look forward to working with all of you.
You bet. Welcome aboard.
Thanks, Jordan. So I'm happy to take any questions about the contract or the work that will be done, if there are any.
Melissa, when do you think they'll have a report for us?
They should have a report by the end of August. The contract actually runs through the end of December, just to give a little wiggle room, depending on, outreach efforts are going to look a little different because of COVID. So we built in a little wiggle room for them, but ideally this report will be done by the end of summer, early fall.
Great.
Thanks.
Looks like Martin has his hand up.
Hey, yeah, good morning. Just trying to figure out how to formulate a specific question, but what's the ultimate goal here? Do you envision a housing trust fund like the city? Is the goal to boost affordable housing in the county, to explore regulations that make that easier? I mean, what are you looking for here?
It looks like you described a lot of what we might be interested in finding out.
Okay, great.
All of the above.
So Martin, I think we're hoping we'll get this report back on a housing study, and that will provide us with some direction and some ideas and some data, so we can make some real sound decisions on how we best spend our resources.
Great, thanks.
And Martin, you were just starting to go down the list of items that we want the consultant to look at. So I'd be happy, if you want more detail, I can send you the RFP that was issued, and it would have a lot more information for you.
Okay, thank you.
And we're getting a screaming deal for $30,000.
Yeah.
Yeah, most consultants will not even roll out of bed for that amount of money. So, and if there are any other members of the media who would like what Melissa is sending to Martin, please reach out and we can get you that same information. Any other questions? Okay. So did we already get a motion in a second on that?
Then I'll move that the board approve the contract with Eco Northwest.
Excellent.
Second.
Any further discussion? All in favor? Aye.
Aye.
Yeah, this is an important piece of business. Thank you. And Melissa, it looks like you are on for the next item also. A request the chair sign a second addendum to Western Cider's CDBG revolving loan fund loan.
Yes.
Real quick, sorry, Melissa, did you see that Maritza, oh, never mind, Allison's on it, wanted a copy as well? Just wanted to make
Okay.
sure you saw that. Okay.
Thanks.
That's great.
Sorry.
And I'm happy to provide folks with the scope of work from Eco Northwest as well. I think that will provide a really good roadmap and some additional information on how they're planning to move forward and when things will happen. So I'm happy to get that info out.
Thank you, guys.
Yep. Go ahead, Melissa.
So the next item is just an addendum to the loan agreement with Western Cider. Western Cider is the recipient of a Community Development Block Grant Economic Development Revolving Loan Fund grant, and that agreement's in the amount of $170,000, and it originated in 2016. So this addendum just shows a change in ownership structure for Western Cider. It does not impact their loan agreement with the county at all, aside from recognizing that John Clarenbach resigned and his interests have been transferred to the two remaining owners, Matthew LaRubio and Michael Billingsley. So I'm just looking for your approval of that addendum today.
So Melissa, I just want to let it be known that my voting for this has nothing to do with my appreciation for their delicious products.
That's an important clarification.
Clarify, has not swayed me at all, but I would move, I think it's your turn, Juan.
Oh, I will move that the board, or that the chair sign the second addendum to Western Cider Companies LLC, so we can continue to appreciate their delicious products.
I'll second that.
Okay, any further discussion on this item? All in favor?
Aye.
Aye. All right, thanks, Melissa.
Thank
Our
you.
final action item for today needs little, if any, introduction. This is just one of these standard employment agreements. This one is for, it looks like Sarah Horn with PHC with a rate of pay listed there and 40 hours per week. And is there something that you want to add, Chris?
I was just going to add that this is actually a new physician for Partnership Health Center that will be joining Partnership in their new child and OB section of the clinic, which you'll recall they started a couple of years ago with Dr. Vanetta as the first physician to come over. And so this is just as they continue to expand and ramp up that service, but this is a new physician who's joining them.
Welcome, Dr. Horn. Fantastic.
Yeah. Way to go, PHC.
What do you guys think? Can we do it?
Yeah. I'll move that we approve this this contract or employment agreement.
Okay,
Second.
Moved and seconded. Anyone out there have any further comment on this one? Seeing none, all in favor?
Aye.
Aye. Okay, thanks. So ends our action items. Correspondence, we have a letter on public health legislation. Chris, or who wants to speak to this?
So I think we have both Allison and I here who can speak to this. So as you know, there have been just a host of legislative bills this year related to local health authority. And so what we've done is draft a letter because all of those bills are going to business and labor, which is not necessarily the committee we'd expect, but they have been tasked by leadership with looking at all of the bills and then coming up with one bill as the vehicle for the changes that the state would like to see in that legislation. So commissioners, this tries to incorporate and encapsulate the conversations we've been having throughout the legislative session, both as your legislative team and also with the commissioners at your admin meetings, about what we think are the important things for the state to keep in mind as they look at those changes. And so one of those main things being, allowing health officers the authority they need during emergencies, providing a balance to that authority through the wonderful relationship we have with our health board here in Missoula and their expertise, as well as a balance with our elected officials, both at the city and the county. for that particular piece, and then also kind of clarifying that language, and this is in line with the Montana Association of Counties, that the health officer is a county employee when they're in a city-county health board, which is already the relationship we have, but just making sure we kind of keep that. And so Allison did a wonderful job of kind of capturing all of that into a letter that we have sent on to the health, to the business and labor committee, which is the one tasked with this. And so we anticipate that we will see a bill out of that committee sometime this week, as transmittal is the early part of next week, by which all general bills have to have moved between houses.
Great, thanks.
Wow, this is so impressive, Allison, and all.
Yeah,
Allison.
great.
Yeah, thank you.
Yeah,
For capturing.
And the letter has already been transmitted, so thank you.
You're welcome.
Yes.
Okay, next, our main discussion item today is to take a little deeper dive into our vaccination coordination team. This is something that's been spun up in the past couple of months here to support vaccination for COVID-19 throughout the community. And I believe I'll turn it over to you, Adrian. You can handle this however you want.
Thanks, Commissioner, and I hope I'm going to meet your intent of what I thought you kind of wanted me to talk about today, was really about how we're utilizing this team through kind of common incident command structure. And so we have deployed a Type 3 incident management team to work under the Office of Emergency Management, and just kind of the high level of why we utilize the ICS system, something like this, in that it's a large coordination effort, and ICS is really based on objectives-based management. And to kind of dissect that a little bit, we start with what I will call kind of an overarching leader's intent. And as the agency administrator for the Office of Emergency Management, it's kind of my job to kind of give them that leader's intent, and the incident commander to take that leader's intent, make it their own, and then turn that into objectives, which then drive tactics. And so I thought I'd just kind of go over what the leader's intent is, what the objectives are, and then how we are meeting those objectives, and then kind of give a current situation report of what's going on today in the community relative to vaccinations, and then kind of what we're planning for in the immediate future. So the leader's intent generally is that the Missoula County COVID-19 Vaccination Coordination Team, which we have, of course, turned into an acronym of the VCT, Vaccination Coordination Team, will open lines of coordination among all vaccine providers to ensure accurate and timely information and data exchange, coordinated vaccine efforts, sharing of resources where appropriate, and planning for each phase of vaccination in Missoula County. Now, whenever we have leader's intent, we always want to make sure we kind of put a pin in what is the end state. You know, when will we think that we're done? And for our end state, it's that we will remain in place with this coordinated effort until COVID vaccine is widely available in Missoula County to any resident over the age of 16 wishing to get vaccinated. So it's not just once we get to kind of that phase 2 of vaccine being open to the general public, but when we have successfully kind of saturated the market, so to speak, with vaccine being widely available, that those wishing to get and access a vaccine have an easy time doing that. As we know right now, with just an incredibly limited supply, a lot of our focus on the front end was to really get a good situational assessment and to create that common operating picture, not only amongst our team, but also amongst all the providers. There are really 2 avenues in which providers get vaccine. One is through the state allocation process that does come from the federal government, but it's an allocation based on the state's population. And that typically will run through the State Department of Public Health and Human Services. Just keep in mind that the vaccine doesn't sit in Helena; it still sits at those federal resource allocation areas. But the kind of the allocation process does come through the state for most of our providers. Then there's a direct access to the federal allocation system, which, as I think we all heard last week, the great news that Partnership Health Center has been tapped as one of the 250 federally qualified healthcare centers that are going to be able to have a direct federal allocation that does not impact our county allocation based on our population. So it's in addition to, which is great news. And then also there's the private pharmacy program that also can register into that federal pipeline. And so a lot of our work has been to understand what those allocation processes are, to understand what those reporting requirements are, and to understand which of our providers are tied into which system. So our objectives, and I'll just kind of read them off here. First objective is to provide coordination between all entities providing and receiving vaccine in Missoula County. Provide connectivity between vaccine providers and the public as needed. Compile and track vaccine numbers in Missoula County. Provide timely and accurate information to the public and stakeholders regarding vaccination efforts in Missoula County. Compile, track, and deploy resources as needed to achieve vaccination objectives in Missoula County, identified as vaccine being readily and easily accessible to all residents. And identify any limiting factors to delivering vaccine in a coordinated and timely manner. Obviously, our primary goal is to never have vaccine sitting in a freezer somewhere with no plan of how to get it out. And then this last objective was just recently added, and I think it highlights kind of the necessity of having this centralized coordination effort. And it is to order all Montana state vaccine doses designated for Missoula County from DPHHS every week. And so up until about a week ago, each provider would fill in a request and send it up to the state. And then the state would have to determine of all the providers across the entire state, not just in Missoula County, which providers were going to get vaccine from week to week. And that became hard for DPHHS to do because they don't have kind of that boots on the ground knowledge of what's occurring and what the capacities are of each provider. And so what we've been able to do is to take that role on where we have that direct communication and coordination with each of the providers to understand what their capabilities and capacity is for the following week. And then we can make that recommendation to DPHHS as to which providers will get an allocation of vaccine in the coming week following. So how we've kind of turned those objectives into tactics are that we have weekly meetings with all of the vaccine providers in Missoula County, where we all gather around our virtual screens and we talk about the current situation. We talk about any limitations, any barriers, any issues that they have. And this really becomes the opportunity for providers to help each other and in many ways to identify problems that maybe another provider can help them solve, which is part of this coordinated effort, right? And so, you know, we have a real shining example of where that was really beneficial. And I see that Sarah Heineman and Jake Fuller are on, and they certainly can add to this. But, you know, we were able to facilitate kind of a marriage of All Nations Health Center and Missoula County Public Health by way of, you know, All Nations had some vaccine and they have an identified client base, but they really had a limitation in the number of vaccinators and the ability to get through their patient base in a quick fashion. Missoula County Public Health, on the other hand, had a ton of vaccinators, but not a whole lot of vaccine at the time. And so we were able to kind of bring those two entities together and really do some phenomenal work in getting a tremendous amount of All Nations patient base through the vaccination process, utilizing some of All Nations vaccine as well as some of the vaccine allocation from Missoula City County Public Health. And those kind of coordinated efforts between providers are happening every single week, and it's really kind of fun to watch. The way we do that is we have designated liaison officers that have kind of broken up all of our 27 providers in Missoula County, and they have daily conversations with them to understand not only what they're doing, what they're planning, what resource limitations they have, and then that comes back to the team to help facilitate and kind of bolster their efforts where appropriate. Probably the biggest lift has been in creating kind of a centralized portal for the public. Public information is probably one of our biggest tasks. We understand that the anxiety and the angst around getting a vaccination is something that is very important to the public. And so we wanted to make sure that we had a really kind of one-stop shop, if you will, where people could go and find out not only where they could get a vaccine, but possibly when they could get a vaccine, how appointments were going to be made. They can check in to see what their providers are doing specifically to help alleviate some of that concern. As well, we stood up a call center specifically for that same purpose, so that the public can call in. That number is 258-INFO or 258-4636, and they click option 3 or hit option 3 rather. That takes them to our call center where we have staff Monday through Friday. We have staff 7 days a week, 8 a.m. to 5 p.m. that are there to answer any of those questions that people have. A lot of it's designed to be accessible so that individuals who may not be comfortable navigating the internet or that website, or maybe not have internet access at all, can call that line and get the same information that's on the website. And in some cases, when we have these public-facing clinics, which I'll talk a little bit more about here in a minute, we have a designated amount of those available appointments set aside so that individuals can call into that info center and register for those appointments, again, if they can't navigate the website. I'll kind of talk very high level as to kind of what our approach right now is in this kind of environment of very limited vaccine supply, and that we really have kind of two methods that we're trying to keep fed with adequate vaccine supply to ensure that we have focused options available for vaccination. And those focused options are typically through our major providers. So Community Medical Center, Partnership Health Center, Western Montana Clinic, and Providence through St. Pat's, who have electronic health records where they can identify those patients of theirs who meet the 1B Tier 1 criteria and can really be genuine to what we're trying to do right now, which is providing vaccine to our residents that are most at risk. And they are in a phenomenal position to do that because they have that data and they have that patient list, and they have the ability to reach out and contact those patients as they have vaccine available. And so we always want to keep those focused clinics kind of in a vaccine supply so that they can continue on with that effort. But also understanding that that there's a tremendous need out there, and that we need to have some what we call open opportunities for folks, and that these are kind of on the open market, as you might say, by way of the public can schedule themselves for a vaccine as those opportunities become available. And so right now, the main focus for open clinics is certainly Missoula City County Public Health with their mass vaccination clinic that they've stood up at the old Lucky's Market at Southgate Mall, as well as the University of Montana School of Pharmacy and their capabilities to do mass clinics at the University of Montana at the Adams Center. And then Community Medical Center has also dedicated a portion of their available appointments, not only just for their patient base, but they do make a portion of those available for the public as well. Early on, when we transitioned into phase 1B, there was a recognition that there were some long-term care facilities that had a pretty acute need that weren't serviced through the federal allocation program through CVS Pharmacy or Walgreens Pharmacy. They got missed for whatever reason. And so we were able to do some very focused mobile clinics with those identified long-term care facilities that had a resident population, a patient population that met that 1B criteria. That thus far has been completed, and right now our main focus is on these focused clinics and open clinics. But we continue to look at opportunities as we continue through these phases for mobile options, recognizing that we do still have a significant number of individuals within our community that may really need to have that mobile option. And so we're always kind of looking at and planning for what could look like, which providers have the capability to kind of make that service available. So the current situation, you know, what part of what we really tried to understand is capacity of our providers, and keeping in mind that the current vaccines that we're dealing with, the Moderna vaccine and the Pfizer vaccine, being a 2-shot dose requirement, just adds another logistical complexity, and that whatever dose you give to someone, and either 3 or 4 weeks later, you have to give it to them again. So when we look at some of these mass clinics and what their capacities are for daily shots administered, we have to factor in how many of those are a first shot, how many of those are a second shot, and what that does to the capacity of that particular provider. And so what we've tried to do is kind of create, if you can kind of envision this teeter-totter effect, where we kind of push a bunch of vaccine at a particular provider for them to do first shot administrations, and we keep pushing until they start hitting their second dose, and then we back off and we find another provider to push first shot doses to, so that provider who goes into a second shot dose, their daily doses that they're giving doesn't change. It's just that they're seeing that patient for the second time, whereas then we can focus new first shot doses to another facility that that doesn't have that second shot kind of occurring simultaneously, if that makes sense. Additionally, right now we're working pretty closely with Partnership Health Center in the with their new federal allocation, and kind of understanding what that means, and what their limitations currently are to meeting kind of a pretty high threshold of weekly vaccine administration, and trying to find them some additional resources to make sure that they're successful in that endeavor. The other big thing that that we're currently working on is data. You know, it's important to know where we've been as far as how many doses we've administered, and kind of looking in our rear view mirror, so that kind of informs where we need to go, and when it makes sense to start looking at the current phasing that we're in, and any changes or modifications to that. Does it need to be opened up more, and when is the appropriate time to do that, based on how many people we vaccinated against the data that we have for our kind of holistic population. And I kind of ran through that real quick. I'd be happy to answer any questions.
Thanks, Adrian. This is a super complex and challenging process that you guys have done a remarkable job on. Why don't we start with, there's a lot of members of the media on the line here, and I want to give you all a chance to ask a few questions first, and then we'll go to the commission. Maritza.
Thanks, Adrian. I'm just wondering, I've had a lot of people ask when you think it might open up to this other section of 1B, like folks with underlying conditions. And I know that the actual allotment and doses has been a challenge, but do you guys have any kind of timeline on that?
Thanks, Maritza. I wish I had, you know, kind of a date to put on the calendar. We don't right now. We are continually evaluating that, and in fact, today we are meeting with a kind of a group of stakeholders that has all this data to really look at just that: is when can we anticipate moving into the next tier of phase 1B. Recognizing that it is a very large number. You know, our estimates are that that's about 40,000 people, which is why that initial stratification was necessary in the beginning.
Thanks. Katie Miller, and 40,000 folks, for folks who don't know, that's about a third of the population of Missoula County. Katie Miller, it looks like you're on mute. There we go.
We're just wondering if you could kind of explain the process. Like, people are kind of frustrated getting appointments for some of the vaccine clinics. Like, how quickly do you guys find out when you're getting new doses in, and like how quickly is that turnaround to get the clinics going?
You bet. So we are always working kind of a week ahead as far as our ordering process goes, and asking for our allocations and identifying which providers are going to get that. But we have been very deliberate in not making appointments available until vaccine arrives. I mean, I think we've seen in other parts of the country, and certainly with this last weather storm that hit the southern part of the United States, that disruptions to that can have just this enormous ripple effect if you have kind of these pre-scheduled appointments for vaccine that has not arrived yet. Typically, the vaccine arrives into the county early in the week, a Tuesday or a Wednesday, which then kind of informs the next week ahead. And so what we have worked really hard with our PIOs and our Joint Information Center is to make sure that when vaccine appointments are going to kind of become available for these open clinics, that we give the public adequate notice through press releases. And if you go to covid19missoula.co, which is kind of the portal for all of this vaccine information, we'll put messaging in there for these open clinics as to when we expect those clinics to become open and available. But yeah, it's kind of like getting a concert ticket, unfortunately, in that when we put those appointments up online, they go very, very quickly, and we understand that that's frustrating for folks. As I mentioned, we've been working with the Rural Institute as well as Missoula Aging Services to make sure that all of our messaging is accessible, that people can understand what we're trying to do, but also to help identify any barriers that people have to the current methodology that we're using for vaccine scheduling of appointments. And so that has informed some of our processes around the call center, that 258 info number where people can call in if they have trouble navigating the website, if they don't have internet access, and in some cases, if they're just not internet savvy. I mean, you have to be pretty quick entering your information in order to secure one of these spots. And so taking that pressure off by having a call-in option for folks that can take a little bit more time, knowing that slot is secured, that our call center can help them connect with.
Thanks, Adrian. Thanks, Katie, for the question. Let's go to Maritza again, and then to Sheila Callahan. Oh, Maritza, did you have a follow-up question, or?
Sorry, I forgot to unmute. I should know by now better. Two more things. One, Adrian, and again, I mean, this always goes back to that supply issue, but wondering when you think some of these smaller primary care clinics, smaller doctors' offices not associated with the two hospitals might start to get allotments, and then also I know that there was discussion about how to reach folks who are homebound and palliative care patients, and I'm wondering if there's any further discussion about that, maybe bringing it on the road and actually going to homes of some of these folks who are in the vulnerable group.
Totally. So as to when some of these smaller providers will start to receive vaccine, some that are connected into the federal private pharmacy program may start receiving vaccine very soon. Some actually already have. As far as when others may, it's a supply issue, right? And it is going to get better. That's the silver lining. We know that it is going to get better. It's getting better every day. When we started this several weeks ago, our allocation in Missoula County was about 1,500 new doses every week. So that's not including the second doses. So 1,500 new first shot doses every week coming into the county. What we've seen is a slight uptick to that number, and it just continues to get better. It's not a watershed by any means. It still is a extremely limited amount based on our population, but it will get better, and we will start to see some of these providers come online. And I think that's really important. We want to have as many options and as many places as we can so that the public has as easy as a time navigating and finding a vaccine appointment when they can. And that's going to require lots of facilities to being able to do that. We're just not quite there yet. In regard to kind of bringing the shot to folks, certainly it's on our kind of hit list of things that we want to build capacity around. We're not quite there yet. We have identified some providers that do have that capability and are willing to do that. And we're working with some of those agencies that I mentioned before in our Access and Functional Needs Committee, with Missoula Aging Services through the Rural Institute, to help identify some of these patients and some of these residents in Missoula County that may require that at-home dose administration.
Thanks, Adrian.
Thank you.
It looks like Sheila, you have a question. Let's take yours, and then we're going to have to pivot to the commissioners if they have any questions, and we still have a couple other agenda items that we need to deal with today. So Sheila?
Thanks, Commissioner Strohmeyer. Adrian, my question is this. Our research showed that about half of low-income seniors do not have access to the internet, and as many as 25% of even high-income seniors may not have access or use the internet simply because they find it difficult to navigate. With those numbers, do you feel like you're setting aside enough doses of the vaccine when you announce a clinic for people to call in and get doses?
Thanks.
Thank you, Sheila. Yeah, and we've been looking at a lot of the same data, and that has been informing kind of the numbers that we pull aside from these open clinics, and it is anywhere from 20 to 25% of all open seats for an open clinic we pull aside for the call center.
Thanks. Okay. Thanks, Sheila, for that. Thanks, Adrian. Josh or Juanita, any questions?
Sure. Just a quick one. Adrian, have you heard anything, or do you have any insight on the Johnson & Johnson vaccine coming online, and how do you think that'll change things here?
I think, more vaccine, all the better, right? It's up for a hearing tomorrow with the FDA for emergency use authorization. We expect that emergency authorization will be granted, and further, we expect that probably within 2 weeks following that, we would start to see it coming into the state of Montana. It does present some wonderful opportunities in that it is a single shot administered dose, which, back to kind of that logistic situation, it makes things a lot easier.
You took my question, Josh.
Oh, sorry.
That was great. And Adrian, I really, well, this whole report I've appreciated, but your visual of the teeter-totter explaining the first and second shot, that's super helpful. Thank you for that.
Yeah, thanks, Adrian. Given the level of interest here today, we should probably try to do this again at some point or periodically. So thanks so much for the report.
You bet.
Chris, we may need to tell the health department that we're going to be a few minutes late because I suspect that we might have some things related to the legislature that we should address here.
Yeah, commissioners, there's actually only one bill that I was going to bring to your attention today, and I know you do have that health department meeting. It is not a pressing matter, so we can certainly postpone that bill till another time. So.
Jeez.
Okay.
Yeah.
I'm on the edge of my seat. Like.
Yeah.
So I can give you a quick overview if you want, really quick. Sure. So the bill that we were going to talk to you about today is actually from one of our representatives, Willis Curdy, and that's why we're going to talk about it. It's House Bill 532. Which will be heard in taxation tomorrow. The bill basically requires, whenever there is a voted levy, for us to publish additional information for each taxpayer based on the cost of that new proposed levy that the voters would be voting on in increments of $100,000 up to $1 million for every taxing jurisdiction. That roughly translates to about 63 different calculations. That would show up
on the ballot.
I was
so this would be required to be published, yes, not necessarily on the ballot, but as a supplement to the ballot.
So would that mean, Chris, that everyone gets a notebook with their ballot?
They will get a pretty lengthy missive. Of course, it is one of our representatives carrying it, so we've asked Rebecca to reach out to him and just talk about if there's a way that we can kind of simplify that down to, something like where it would just be one notice that would be available for folks to go look at somewhere, which is contemplated in his bill. But the difficulty is, as proposed, you have to calculate it for each house. And Andrew could speak to this more intelligently than I could, but the idea being that, my house on River Road may not be in the exact same taxing districts as one that's on Higgins, and so therefore it's not like you can create just one and it's universally true, and that gets even more complicated when you go out into the county where you have rural fire districts as well as a host of other things like irrigation districts and everything else that just make significant changes across property taxes across the district. Very few houses are exactly the same, and so.
Andrew, did you want to chime in?
Yeah, what we have is 65 different taxing districts within the county of Missoula, and I took one taxable value and applied it through all 65 different taxing districts, and it only matched, the numbers only matched twice in the entire 65 districts. So they're asking us to do 7 calculations per district for a total of 455 or some calculations for all these different homes at different values in different districts. So it would be literally impossible for the treasurer to get it done and put it on a ballot. And then they're asking for it to be published again within 10 days of receipt of the treasurer receiving the tax record. We're not sure what that even means, receiving the tax record. That's certified taxable values or what it is, but it's an enormous amount of work and just a huge amount of paperwork that would associate itself with each ballot.
Does MACO have a position on this?
I have not yet heard whether they do, but where it's one of our legislators, we've just asked Rebecca to reach out to him and see if we can maybe provide a friendly amendment that would help kind of clarify this language so that it would be more doable. Because obviously, I think the goal is to make sure that when voters are voting on a levy, they have an idea of what the impact will be to them. And that's not necessarily a bad thing. That's why we already do the calculation on $100,000 and $200,000 valued home. But there may be a different way to present this that would still meet his intent. So we've got Rebecca reaching out to him, but that's really the only thing. Is, we're rapidly approaching transmittal, so we've largely got the bills that are going to be heard out there at this point, and so we continue to send messages on those. But that was a new one today that we just wanted to make you aware of, where it's one of our legislators. So
you can't have someone in Jason's shop build a website where someone could just enter in their home value and figure it out.
I am sure Jason could do that with enough time and money, because his shop is darn impressive.
Yeah.
Time and money.
Time and money, that's all it ever takes.
I mean, it seems like that would be the sort of solution that you go to a web page and type in your address and you get a calculation that's close. But even that's a big lift for us. It would have to be created. I get that.
Yeah, we actually have to produce the tax bills in order to know what the calculation is, and that's over a month's worth of work with the DOR, local Department of Revenue, and our own staffs. When we send the bills out, that's when we know how to do the calculation. We could put it on a website after that, but I'm not sure applying it to each ballot makes sense.
Right.
Andrew, would there be a way to do it off of the previous year's numbers to give a person a kind of a general sense?
Sure. Yeah, I mean, we could do it for the existing year, but
it's not going to be exactly accurate.
No, it isn't. And what I think he's asking for is what would be the effect if there was a voted mill, and so that's the complication we're dealing with.
And I think the way that we're doing it right now, with we can say this is what it would be for a $100,000 house or $200,000 house. There is no $100,000 house. There is no $200,000 house, but it gets you kind of some foothold into the math, and a person could figure it out for themselves. Hopefully that's enough.
Yeah, well, hopefully after some conversation with Representative Curdy and explaining the administrative burden this would create, and maybe not the bang for his buck that he's thinking out of this, maybe there could be some tweaks, or perhaps a self-tabling. One never knows.
The self-tabling.
Okay, anything else urgent before we need to slip over to the folks in the virtual waiting room?
No, thank you, commissioners.
Thanks.
Okay, thanks everyone. Goodbye.